Almost every stump speech this presidential season involves health care. Generally speaking, Republicans want to end Obamacare. The Democrats want to spend more taxpayer money on health care. We're going to take a look at the Republicans' health care plans a little later in the show. But first, how do Hillary Clinton's and Bernie Sanders' plans compare? For that, Bruce Freed joins us. He is Denton's managing partner and was director of the Center for Medicare at the Center for Medicare and Medicaid Studies. So I think that sums up that you're pretty qualified to talk about this issue. As we look off the top of this, Bruce, big picture, what does Bernie want to do?
Well, Bernie and Hillary, Senator Sanders, Senator Clinton, really ultimately have the same objective: universal coverage for all Americans.
Don't we have that under Obamacare? Is that...
We do not. As much progress has been made by President Obama, the reality is there are still 20 or 30 million Americans without health coverage.
So how does Senator Sanders propose on doing this? And he's talked about this a lot on the stump.
He does indeed. He would want to move the entire health care system to a single-payer health care system, what he calls Medicare for all.
A la the United Kingdom.
Canada, the United Kingdom, there are a number of countries in the world who, out of their tradition, have created this government-run approach to providing health care.
All right, and take a listen to how he justifies that on the stump.
We are the only country, major country on earth that does not guarantee health care to all people. And yet we end up spending almost 3 times what the British do, 50% more than the French. My proposal, a Medicare for all single-payer program, will save middle-class families many thousands of dollars a year in their health care costs.
Now, he says many thousands. His campaign says the typical middle-class family of 4 would save over $5,000 under his plan. What he leaves out, though, in that stump speech is we did the math for a family of 4 making $80,000 a year. Under Bernie Sanders, their taxes go up $10,700 a year. That doesn't really seem like that good of a deal if even the $5,000 number holds. This could cost a lot more.
It's a fair analysis. Others have looked at Senator Sanders' proposal, and while his campaign has projected that it would add costs of $1.4 trillion a year over a 10-year period, other very highly regarded health economists have actually found that the cost would be closer to $2.7 trillion a year.
So the deal could be even worse than what we had just laid out, essentially. You'd have to even raise taxes more to pay for it.
It would be a challenge to achieve what he's after.
All right, so that's what he wants to do. Hillary Clinton seems far less specific in terms of policies that she's laid out, and she was the one who really first started talking about health care back in the 90s.
I'd actually challenge your assessment. I think her approach has been much more carefully articulated.
Okay.
Building off the President's Affordable Care Act, recognizing that it does not achieve every Democrat's objective of universal coverage, but she would approach it by addressing the expansion of Medicaid for those poor folks who did not get brought into the system, by closing other gaps that exist, and I think there's actually a good bit more specificity.
In terms of specificity, are we able to garner from that specificity what the cost would be from it?
Her campaign has projected the cost would be about $100 million. That's not right. $100 billion a year, and over a 10-year period, about $1.2 trillion.
Okay, so she's at $1.2 trillion for 10 years. Bernie Sanders is at 1.3 or 1.4 trillion a year. But as you look at what Hillary Clinton's math comes up, her campaign's math, does that make sense? Because what you just said about Sanders, really the real cost could be double that. Is that the same thing is true for her plans?
I've not seen. We looked very closely for analysis that looked at Senator Clinton's plan. I didn't find anything that was comparable.
Drastically different?
Yeah.
All right, the Republicans are coming up next as we look at what they're going to do and what that might cost. Liz will have that in the next hour. Mr. Freed, appreciate your time, sir.
It's great to be with you, Leland.
Good to be with you. Thank you.